Dear students, welcome back. In this session, we are going to discuss about the muscles of anterior compartment of the leg. The muscles of anterior compartment of the leg are the tibialis anterior, and then you can find the extensor hallucis longus, which is deeply placed. Here you can find this extensor hallucis, and over that muscle you can find extensor digitorum longus, and towards the lateral side on the anterior aspect you can find the Peroneus Tertius or Fibularis Tertius. So these are the four muscles present in the anterior compartment of the leg, and now we are going to discuss about its origin, insertion, nerve supply and action. Okay, tibialis anterior. It has a spindle shaped belly with multipennate fibers. So this is the tibialis anterior. And if you see the origin, it is originating from the lateral condyle of the tibia. Here you can find this is lateral condyle of the tibia, and upper 2/3 of the lateral surface of the shaft of the tibia. So as we know that the medial aspect of the leg is subcutaneous, so there is no muscles on the medial aspect of the tibia. So this muscle is originating on the lateral surface of the shaft of the tibia, that to upper 2/3 of the lateral surface of the shaft of the tibia, and also it is originating. So here you can find the lateral surface, okay, and also some of the fibers are originating from the adjoining interosseous membrane. This is the interosseous membrane. So this muscle is originating from the interosseous membrane. These are the origins of the tibia, and it is getting inserted into the infero-medial surface of the medial cuneiform and the adjoining part of the base of the first metatarsal bone. So here you can find this. So it is attached to the infero-medial surface of the medial cuneiform. As we know that there are three cuneiforms: medial, intermediate and lateral cuneiforms. So in that, the medial cuneiform, at the infero-medial surface of the medial cuneiform, and also the adjoining part of the base of the first metatarsal bone. So if you see the nerve supply, it is supplied by the deep peroneal nerve, and if you see the action, it mainly helps in the dorsiflexion of the foot. So what is the action? Dorsiflexion of the foot, and also inverter. So, and also inverter of the foot. Keeps the leg vertical while walking on uneven grounds, and also this muscle maintains the medial longitudinal arch of the foot. Medial longitudinal arch of the foot. These are all the functions of the tibialis anterior. Now we will move on to the next muscle, that is extensor hallucis longus. So this muscle is placed somewhat deep. Over this we can find tibialis anterior and extensor digitorum longus. On the lateral aspect we can find the Peroneus Tertius. So this extensor hallucis longus, which is originating from the posterior half of the middle 2/4 of the medial surface of the fibula, okay, medial to the extensor digitorum brevis, and also the adjoining part of the interosseous membrane. Okay, this is the origin. So one is the posterior half of the medial 2/4 of the medial surface of the shaft of the fibula. That is the main thing you have to consider here. And then adjoining part of the interosseous membrane. This is the origin. And if you see the insertion, It is at the ankle. The tendon lies just lateral to the tibialis anterior. So we have already discussed what are the tendons which are passing through this extensor retinaculum. First the tibialis anterior, and then we can find the extensor hallucis longus. So just lateral to the tibialis anterior tendon, and it is getting inserted into the distal phalanx of the great toe. It is getting inserted into the distal phalanx of the great toe, that to base of the distal phalanx of the big toe. On which surface? Dorsal surface. This is the origin and insertion. If you see the action of this muscle, nerve supply, it is deep peroneal nerve, and if you see the action, it helps in the dorsiflexion. This one is also helps in dorsiflexion of the foot and extends metatarsophalangeal joint. So it helps in the metatarsophalangeal joints extension. Okay, and also interphalangeal joints of the great toe. Yes. Now we will move on to the next muscle, that is extensor digitorum longus. So this extensor digitorum longus is originating from the lateral condyle of the tibia. Okay, and the whole upper 1/4 and anterior half of the medial surface of the shaft of the fibula, and also upper part of the interosseous membrane. So this is the origin of the extensor digitorum longus. So if you see its insertion, so the insertion here you can find it divides into 4 tendons for the lateral 4 toes. So it divides into 4 tendons for the lateral 4 toes. So this one we can compare with the extensor digitorum in the hand. So that one is also going to give 4 tendons for the lateral medial 4 fingers in there. Here lateral 4 toes, it is giving the tendons here. Okay, so here if you can see the tendons of second, third and fourth digits are joined on the lateral side by a tendon of the extensor digitorum brevis. So here you can find you can find only one finger here. This one is the tendon of extensor digitorum brevis. So each tendon from second, third and fourth is connected with the tendon of extensor digitorum brevis. So here also you can find the same thing. And if you see the insertion, it forms the dorsal digital expansion, and it is inserted on the bases of the middle and distal phalanges. So it is getting inserted into middle and distal phalanges. You can see here again. So this digitorum, extensor digitorum longus, is going to split into 3 slips. One is the intermediate slip and 2 collateral slips, isn't it? Yes, the 2 collateral slips are going to fuse and getting inserted on the base of the distal phalanx, whereas this intermediate slip is going to insert on the base of the middle phalanx. Okay, at the level of the proximal phalanx only, this divides into 3 slips and it is getting inserted here. Okay, so this is about the origin and insertion of the extensor digitorum longus. And if you see the nerve supply, again it is supplied by deep peroneal nerve, and it helps in the dorsiflexion of the foot and extends metatarsophalangeal, proximal and distal phalanges of second to fifth toes. This is the action of this muscle. Now we'll move on to the next another muscle that is called Peroneus Tertius. The Peroneus Tertius, it is a separated part of the extensor digitorum longus and may be regarded as its fifth tendon, so it may be absent. Okay, so this is about the Peroneus Tertius muscle. If you see the origin, it is originating from lower 1/4 of the medial surface of the fibula. So this is the fibula and this one is tibia. This is the lateral aspect here. Okay, and also the adjoining interosseous membrane. And if you see the insertion, it is getting inserted into the medial part of the dorsal surface of the base of the fifth metatarsal bone. So here you can find on the medial part of the dorsal surface of the base of the fifth metatarsal bone. This is the origin and insertion of Peroneus Tertius. If you see the nerve supply, again it is supplied by deep peroneal nerve. If you see the action, which helps in the dorsiflexion of the foot and also helps in the eversion. It helps in the eversion of the foot. Okay, so these are all about the muscles of the anterior compartment of the leg. In the next session, we are going to discuss about the muscles of the dorsum of the foot. Thank you.